Well, Rocky, welcome back to Shasta County. For those of you who are joining us, we have Rocky Herron joining the program. He's a former DEA agent with 32 years of experience in the DEA. And so, Rocky, we would love for you to just give us an overview of your life leading up until this point.
All right. Well, thank you. It feels good to be back in Shasta. So, yeah, I was a DEA agent. I started at 23 and worked almost 32 years chasing drug traffickers, mostly in San Diego with the Mexican border, and then 6 years in South America, chasing cocaine traffickers down in Bolivia. But 17 years ago, while I was doing my investigations, I began to arrest a large number of kids in San Diego who'd gotten addicted to oxycontin. And what shocked me was these kids we were arresting for dealing the drug were not our traditional drug dealing population. These were kids from our best schools and our best families. And I was always kind of an inquisitive DEA agent. I wanted to understand why. So I would drive these kids to jail, and on the way to jail, I'd ask them questions like, you had everything in front of you. What made you think smoking a piece of pill and a pill on a piece of foil was a smart decision? And they all started crying, and they all said, "Man, maybe if somebody would have warned me, I wouldn't have started." And at the time, I didn't think anybody would listen. I didn't think kids would listen. But then I very quickly after that discovered my own kids were not getting any drug prevention education at school. DARE was driven out of the schools. I'm not a DARE defender, but what most people don't understand, when DARE was driven out, it wasn't replaced. And I didn't understand that. But I realized that my own kids weren't getting any drug prevention education, and these young kids I was arresting who destroyed their lives hadn't gotten any. And I went to the schools and I started saying, look, can I come in and teach the kids, something basic? So that's how it started for my own kids and their friends. And but by word of mouth, I got more invitations. And by the end of my DEA career 3 years ago, it was essentially my full-time job, going into schools in San Diego and around the world, just sharing with kids what I've lived and what I learned as a DEA agent. So that's what brings me back to Shasta. This is my third school year to be here, and I'm very happy to be here with your kids and looking forward to a pretty busy week of activities.
Yeah, excited to have you back and excited to have you on the Inspire Shasta podcast. So before we get into the bulk of your incredible work, we want to just kick something off with a fun question. This is a question we ask every guest on the Inspire podcast. If you could go back to any grade in school for one day, which would it be and why?
Oh, that's pretty easy for me. It's fifth grade, Mrs. Kunkel. Just the most engaging teacher I ever had in school. I had a best friend in fifth grade, and we just loved coming to class. And we were troublemakers, but we were really good students. And Mrs. Kunkel had the confidence to let us be, little troublemakers and get away with a certain amount of shenanigans. But she just made school completely enjoyable. And she made it enjoyable for every student in the class. And I don't think I ever quite enjoyed school as much after that.
I love that. Sounds like she built a relationship with the kiddos in her classroom.
Absolutely did.
Yeah, it's very important. What accomplishments are you most proud of in your career?
In my investigative career or my school teaching career?
It's both.
Yeah.
So in my DEA career, I had the good fortune to do a large number of different things, different types of investigations. But I think the years that mattered most to me were 2007, 2017, and I was assigned to DEA's prescription drug abuse investigations unit. And I took the transfer to get away from a horrible boss. So I begged for a transfer away from this bad boss, and they put me in this unit investigating pill crime. And it was not a sexy place to go at the time. No self-respecting DEA agent wanted to investigate pills. It was all about cocaine and heroin and methamphetamine. But when I got in that unit, I discovered how bad the prescription drug abuse problem was. Mm-hmm. And this is in San Diego, 2007, we were still Vicodin and Percocet abuse, massive amounts. And oxycontin hadn't quite hit yet. But I was shocked to learn how big the prescription drug abuse problem was and the toll it was taking on society. And then very quickly after that, oxycontin hit San Diego. But in those 10 years I was there, I did 6 investigations on doctors. And I ended up arresting and convicting 6 doctors for bad prescribing. And it's funny because of all the major drug traffickers that I investigated and prosecuted, I think those 6 doctors are the best cases for me because they were living large. Yeah. They were going to work as a doctor. They were jeopardizing the safety of their patients for money for prescriptions, sex for prescriptions, stolen items for prescriptions. Really, really bad people. And when you arrest a drug dealer and you catch him with the drugs, it's kind of game over, right? If I've collected the videos and the evidence, there's not a whole lot of argument to challenge why you had the drugs. But when you try to arrest a physician for illegal prescribing, they don't want to go to jail. And they hire the best defense attorneys, and they challenge you. And Agent Herron, you're saying this prescription is illegal. I say it's legal. So you have to think at a whole higher level. So even though these cases aren't the most sexy cases in DEA, they're some of the most complicated to convict a doctor.
Yeah, I would imagine that they feel like they're a little above the law in those situations.
Oh, not a little. They think they're so used to it. They get away with it, and they think they're above the law. They really do. And they're hurting people here, right? And today when you're arresting an international drug trafficking organization, their people are replaceable, right? But you take a doctor out of a community, you have actually made a difference, a beneficial difference in that community. And of course, the drug-seeking patients then look for other doctors. Right. But I felt like I actually was making a difference, during those years.
And how about the accomplishments in the second part of your career, working in schools?
This is amazing. I was giving a talk I speak Spanish, I teach in Spanish. And I was giving a talk to a group of immigrants in San Diego about 2 years ago. And these poor families come here from these other countries, right? Because this is the land of opportunity for them. And they come from places where drug use isn't rampant, where it's just not part of the culture. And their kids go to school in our schools. And within 30 days, 60 days, 90 days, their kids, too many of them, are in the worst part of our culture. And these families are completely unprepared. So I was educating the families and warning them. And this young man stood up and in Spanish, cheered what I was doing. But he came up afterwards and gave me a big hug. And he said, Rocky, that thing you did for 32 years, that was your training. You finally found your real career here. Wow. So it is actually the ability I have, and I don't quite understand why, but it's my ability to stand in front of an audience of kids and they listen to me. And that really is sort of the qualitative difference that the schools and the school systems that support me, when they see me interacting with the kids, their reaction is, oh my God, the kids actually listen to you. Yeah. Because unfortunately, too many of the people that are trying to teach drug prevention, for whatever reason, aren't capturing the attention of the kids. And I'm getting older, I'm 57, and I don't quite know how long I'm going to do this, but my attitude is as long as society's not doing it, this drug prevention education in a meaningful way, and as long as kids keep listening to me, then I'm going to keep standing up in front of them trying to get some of them to listen. And I've talked to 250,000 kids now, and I'm very proud of that.
250,000 kids.
It's pretty incredible.
Yeah.
It's pretty incredible.
Thank you.
Yeah. And I can speak from our experience in Shasta County, going into schools all throughout the school year, and then we get them in the Civic or we get them in the Cascade, and then immediately when you start talking, it's whoosh. And then you've got your captive audience, and I think it's a pretty incredible gift that you have.
No, thank you. Thank you. And people ask me, I have a lot of people who challenge what I do, and a lot of people criticize it. And they'll ask me, how many kids do you think you're reaching? I don't know, right? And I don't know what the question really means, because every single child that sits through one of my assemblies comes away better informed. Yeah. Whether I change their attitude or not about using drugs, at least I gave them more information about the risks of it. Mm-hmm. But in San Diego, where I live, some of the middle schools are bringing me back every year to talk to all of their kids. And last fall, I returned to 6 middle schools, and 6 different kids came up to me, hugging me and thanking me. And they said, last year when you came to my school, I was drinking, I was smoking, I was doing whatever, and I listened to you and I stopped. And I get to give these kids a giant hug. So that's 6 out of 250,000 that I know, right? Now, I'd like to think there's more. Maybe hopefully there's more. But honestly, and I really mean this, if it's just 6, I'll take it. Because I have lived and I've seen, the damage that one person causes. And in the DEA, we do not, to be clear, in the DEA, we do not go after drug users. Yeah. But the just nature of the work is when you're chasing drug traffickers, you end up seeing over and over and over and over again the destruction that drug use causes in our families, in our schools, our communities, our country, and around the world.
Yeah. Yeah. Having the opportunity to watch you speak and be part of these events that you've done in our county in the past, you can tell the impact by the amount of students that want to talk to you afterwards. It's not just the silence in the room when you're up there and the engagement. It's the line of kiddos that want to connect with you after, and the impact that you're making is really, really valuable.
Thank you. No, that is that very direct feedback. And many of those kids, the ones that do come talk to me after my assemblies, are kids who've been damaged and hurt by drug use around them and alcohol abuse around them. Mm-hmm. And so I have 3 goals. When I'm in front of a group of kids, I believe I have three objectives. I want the kids who've never used to stick with that and not start. Yeah. I'm hoping that the kids who are using or who have dabbled will reconsider, back up, or maybe go no further down into the more dangerous drugs that exist today. And I want the kids that have been damaged by somebody else's substance abuse to feel heard and understood. Mm. And I get a chance to say, look at me, it's not your fault. Yeah. Right? And don't make what happened to you, don't make that your future. And those are often the kids that come up and
Yeah.
want to share some terribly sad story with me and get a hug, and I have a few seconds to give them some kind of motivational message, and I try my best.
Yeah.
And I think when you say the line, it's not your fault, it can be felt in the room, which is a really cool thing to experience when you have 900, 700 students in there all at once.
Yeah, and it's interesting. I've gone into small towns. I've taught all over the U.S. now. I've gone into small towns, and in some of the really small schools, I'll mention to the staff or to the sheriff that I'm going to do this, and they watch the kids that they know are at risk, and they said they see those kids actually physically jolt. When I stand up and say, look at me, it's not your fault, those kids actually jolt, because that's just how the child mind works.
Yeah.
They completely internalize that the abuse and neglect is their fault. I was at a middle school in San Diego recently, a very nice neighborhood, and 15 minutes after I finished, a young woman, 7th grader, came in to talk to me, and she whispered that she had been damaged before she was born because her mom used drugs. And I said, well, who are you living with? She goes, well, I'm with an adoptive family now. And she had some tears in her eyes, and I was confused. Like, okay, this happened before you were born. Why are you sad? And I looked at her and I said, do you blame yourself? And started sobbing. And I still am trying to process that. Here's a child who was damaged before she was even born. Yeah. And 11 or 12 years later, she's still on some level blaming herself, like somehow she wasn't a worthy enough fetus. I don't know the process, but it breaks my heart.
Yeah.
You know, but I grabbed her and told her how I felt honored that she shared that with me, and we move on. So the hard part for me is that I don't see society reacting. I mean, I don't get the level of support everywhere that I'm getting from the Shasta County Office of Ed. And until a year or so ago, I was fighting that. I was arguing and pushing on doors and trying to get in, and I realized I just can't do that for my own mental health. So now my goal is to give the absolute best service I can to every audience in front of me.
So just thinking about your time in the DEA to now, we'd love to know how you have seen the recreational drug landscape change in America through your travels through all throughout America.
Yeah, I mean, actually, there's the difference happened in 1995. OxyContin was licensed, and it's been almost 30 years now. But OxyContin changed everything. Heroin was well known, you know, when I was a kid, and in our culture, it was the kind of dead end drug. Self-respecting people did not use heroin. That was the drug everyone knew was dead end. And once you start, you can't stop. That's the dead end drug. And OxyContin came along, and for the first time, you had a pill in a pharmacy that was essentially as powerful as heroin. And early, it's like 2008, I was teaching the public about prescription drug abuse in San Diego, and a man came in the back, and he raised his hand. He goes, Rocky, what's this heroin that comes in a blue pill? And I laughed at him. I said, oh, heroin doesn't come in a blue pill. And I was completely wrong, because he was talking about OxyContin, which for the user is essentially heroin coming from a pharmacy. And that OxyContin abuse trend is what pushed heavy opioid use across America into every demographic. And prescription drug abuse became a huge problem from 1995 until about 2015, legitimate prescription drug abuse. But in about 2015, the drug cartels in Mexico saw how much money Americans were spending on their illegal prescription drugs, and they wanted some of that profit. So we began to see at San Diego at the border seizures of very poor quality copies of pharmaceutical drugs, and they were laughable. I mean, I remember initially when they were like, what is this thing? It looks like it's supposed to be a pill, but the color would rub off. And the example I make is if we tried to fake M&Ms, we're not going to be able to pull it off, right? We're not going to fool anybody. But those early pills were horrible. Well, now nobody can tell. Our chemists in our lab, they can't tell by looking at them. The copies are perfect. So they started making these copies of the pills, initially using heroin, but then they discovered that this alternative to heroin, fentanyl, was cheaper to acquire for them, more powerful. So they began to add fentanyl to these pills. And they discovered Americans liked it. And our country's never been the same. Yeah. So really, the heavy fentanyl use started 2015, 2016. And the death numbers, the overdose death numbers have just climbed every year. This year they ticked down a little bit, which is an interesting conversation. No one's quite sure why that was. But still, it's way over 100,000 a year dying from drugs in our country. When I started my DEA career, we were 10,000 a year. And now we're at 100,000, and we're saying we've accomplished something because it's not 108,000. So even our perception of the problem has gotten distorted.
Yeah.
And we've somehow accepted that 100,000 Americans dying a year is just part of life. Yeah. And so I refuse to accept that.
Yeah.
You know, I remember a different time in America, and I do believe we can get back there. It's going to take a long time and a lot of effort, but I think we can get back to an America that's not so riddled by this abuse.
Yeah, we need to. Yeah. I mean, that's too many deaths. One death is too many deaths.
Yeah. So, so the situation today is that the recreational drugs, and there's nothing recreational about them anymore, but the illegal drugs that are most commonly used in the U.S. are fentanyl and methamphetamine. Yeah. Cocaine is making a comeback, unfortunately, but fentanyl and methamphetamine come from chemicals, which means the cartels producing them in Mexico are not limited by any production limits. It's just how much chemicals they can get, they can churn the drugs out. Yeah. And when we in law enforcement seize 1,000 pounds of meth or 1 million fentanyl pills, historically, if we seized a huge quantity of heroin, there's only so much heroin produced in the world because it comes from a poppy plant, right? And there's only so many acres of land in the world where poppy is cultivated. So even if you're making a very small difference, as a DEA agent, I took some heroin off the stage.
Yeah. Right.
Now with fentanyl, it's replaced instantly. They just turn the factory back on and produce more. So we're in a situation where law enforcement is trying very, very hard, valiantly, to seize the stuff and stop it. But the production in Mexico, mostly, is far greater than anything we can stop. So it's flooding into the country. It's cheaper than it's ever been. And that's what's changed as well. There's no price barrier now. Even our most economically challenged populations, the person who's using drugs can acquire the most powerful drugs that have ever existed. Yeah. And it's essentially free to them.
Wow.
What advice do you have for communities like Shasta County that are largely rural in dealing with the drug landscape in today, and how you said it's essentially free, it's everywhere, right? It doesn't matter who you are, what your income level is, where you grew up, what trauma you have, what class you are. It's widely spread. What advice do you have for rural counties?
Well, the challenge is getting the people in the county to realize that it's a threat for you too. I think too many people in smaller rural communities feel that's a big city problem, that's a coastal problem. You recently had some huge seizures on the 5 of fentanyl pills hidden in raw meat that was being shipped. San Diego is on the border with Tijuana, and half the drugs that come into America come through San Diego, and a bunch stays. So you've got these big trucks or cars hauling the drugs up north to Oregon and Washington through your city and your county, some of it staying. So the population of kids and adults in Shasta that wants to acquire this stuff, it's as easy for them as it is for anybody in any of our major cities. It's available. They know how to find it very quickly because of the internet communications and the texting and everything that's going on. But too many people who live in these counties have sort of a denial that it's the same level of threat. Now, when I talk to the kids in Shasta, they all know everything I'm talking about. The kids get it. They know it's there. They know it's available. Yeah. But the adults, I think too many of the adults still are sort of in this rejection or denial.
Do you think that's largely related to how significant the drug landscape has changed since adults were youth in the days where it was drug experimentation?
Absolutely, yes. So one of the challenges I have is getting access to the kids. And I've been doing this 17 years. I've done 1,300 presentations all over the world successfully. And yet it's still hard to get in schools. And I think it's because too many people running our schools and our school systems don't understand how dramatically the judge threat has changed in the last 5 to 10 years. They still think it was the threat that they were dealing with when they were a principal in a school 20 years ago, or they were a kid 30 years ago. And I'm quote unquote, I'm an expert. It's hard for me to keep up with the trends because things are changing so rapidly. But that is one of the bigger obstacles, I think, is this too many of our adults, too many of our politicians and our school leaders really just don't understand the threat. And then even the ones that do sort of decide it's somebody else's problem to deal with, right? But I look at it, the school today is the only place we can access kids. We don't have churches where kids are going. We don't have big community organizations in most places. So school for me is really the only place we have to try and access the kids on this stuff.
So true.
Yeah. So speaking of the school lens, what lane do you think that schools have in educating students about substance use prevention, and is it necessary to come from schools?
Well, I am in school, inside the school system now. I work for the San Diego County Office of Ed. So technically I'm part of the education system, but I still look at it as a citizen. To me, school's got two main functions, right? Educate the kids, but also create healthy, functioning citizens. And I think we've gotten too far from that. I think we're so focused now on the academic achievement and the standardized testing and the education component that we're not recognizing that this is the only place we have to really develop the kids socially and culturally. And a lot of parents say, it's my job and I'll take care of raising my kids. Well, the reality is that some giant percentage of our kids in Shasta and everywhere else I go don't have stable homes.
Yeah.
They don't have parents. They don't have stable families. So in an ideal world where every kid was coming home to a stable family situation, yeah, we would focus on parents doing it. But in the absence of that, I think school becomes sort of the default place to reach the kids.
Yeah, I mean, you hit the nail on the head right there. A lot of kids just don't have the adults at home to be able to educate them or be present in their upbringing. So when you get the parents that say it's their job to educate their kids on this, that's great. But what about the other part of the population that's not getting it?
Or even worse, the parents are the ones that are driving the behavior we're trying to educate the kids away from. So I was at a Job Corps facility in Wyoming Friday. And after my these are all young adults, 16 to 24, who've joined the federal job training program to build their lives. And a young man came up to me afterwards and shook my hand 4 times. Great big 21 or 22-year-old kid. And finally he opened up and said, Rocky, you talk about how it's going to be somebody close to you who gives you the drugs. He says, but you didn't talk about a parent. And his dad was a heavy cocaine abuser and got the kid using cocaine at 6. And he's trying to, at 21 or 22, he's still trying to
dig himself
out of that and get away from it. So it's again, my reaction to all the headwinds and the rejection of what I do is to go where I'm wanted, right? And recognize that for many of the kids that I talk to, that hour or 90 minutes that I get, that may be it for the year.
Yeah, or depending on what grade, that may be it, period. So earlier you mentioned that there was a point in time when you realized that your own children weren't getting drug education. So you are a parent of 3 daughters, correct?
Yes.
What advice do you have for parents around raising children to be drug-free? We've talked a lot about the education on the dangers of drugs, but parents that want to empower their kids to be drug-free and to stand up to say no and to empower their own friends to not use drugs, what advice do you have for that conversation?
Well, I have 3 daughters. They're 29, 26, and 24 now, and I tried as hard as anybody I know to educate my kids away from it, and each of my daughters at different times, for very different reasons, made some stupid mistakes. And we worked through that as a family, and luckily none of those mistakes were too bad. But I do feel fortunate that my kids were not being offered the same drugs that the kids today are being offered. But I tried it, like I said, as hard as anybody I know, and it still happened. And after each instance with my daughter, I would get over being angry or scared, and I'd come back to him and I would ask him very calmly, sweetheart, why did you make that choice? You knew better. And every time my daughter said some version of, Dad, it was my best friend, it was my boyfriend, it was my teammates. And I realized that as much as I thought I was sort of in the groove and understanding this, I wasn't still in denial. I thought that my kids, for where I lived and how I'd educated them, were safe. And I think too many parents think that we're too good as parents, our kids are too smart, and it's going to be some obviously bad kid that tricks our kids. It's not. It's someone close to them, and that's a big gap because we need parents to understand that, but we can't get parents to come to the education sessions.
Right.
We've forgotten as adults the power of peer influence.
Oh, it's unbelievable. And one of my daughters suffers from anxiety and depression, and during college, she got a chance to go to a huge concert event with some of her college friends. And she told me later that she just felt she was fitting in. She felt wonderful, that she belonged, just wanted to enjoy the music. And then her best friend, look what I got, and pulls LSD, the drug LSD, out of her pocket. And my daughter absolutely knew she shouldn't take it. But at that point, all that mattered to her was fitting in. So she used it, and I was told later that she changed because she made a mistake in her prescription medications, and it took 2 years for her finally to come, explain to me what had happened. And it's just, she knew better. But at that moment, the emotions of fitting and everything took over, and it's terrifying to me because she could have been given a fentanyl pill, and I could have lost my daughter forever at that moment. And so I think that's one of the reasons that sometimes makes me get so emotional and upset that our society isn't paying more attention to this, because I've met hundreds of grieving parents now, people who are much more accomplished, much better parents than I ever was, who will grieve for the rest of their lives because their child made a really, really stupid decision. And they know, and I know, that most of those kids never got a warning, right? And I fully recognize that once you warn the kids, that many are still going to make the bad choice anyway.
Mm-hmm.
Right? But I argue that if I know about a threat and I don't share that with the kids, well, that's on me. But once I've shared the threat with the kids, then they have to start owning some responsibility. And I have a funny example. So in April, I was in a school district in San Diego, in a middle school. And on the Monday of the eclipse, the principal said, hey, we're going to have to stop your assembly halfway through so the kids can go, if they have glasses, they can go look at the eclipse. Great. So the kids go out and watch the eclipse, and they come back in, and this knucklehead kid tells his buddy, I looked at the sun anyway, ha. I'm like, oh. So when the whole group of kids came back in, 200 kids, I looked at them and said, hey, how many of you looked at the sun without the glasses? 30 hands went up.
Yeah.
Wow.
And the poor principal went white because she had warned the kids 3 times.
Yeah.
And so I used it. I said, let's look at this. I heard your principal tell you guys 3 times, very carefully with information, why you don't look at the sun. And 30 of you did it anyway. And I said, I'm telling you the truth on the drug problem. And sadly, I know that some percentage of you are going to ignore it all and learn the hard way. I'm here for those of you who don't want to learn the hard way. You know, and the middle schoolers were looking at me. So it was a great teaching moment. But I think that's sort of the challenge. And when the people who resist drug prevention education in schools will say, well, you're not going to stop all kids. Of course we're not.
Yeah.
But how many do we have to reach to make it worthwhile?
Yeah.
The kids in Shasta who smoke marijuana, right? Mm-hmm. I doubt I'm going to get very many kids who are currently using marijuana to stop. Mm-hmm. But I'd like to think that some significant percentage of those kids who are using the weed maybe do not go on to use fentanyl or meth or something else I've talked about.
Yeah.
We'll never know.
Yeah.
But there's no easy way to define success in this.
Yeah, it's just that investment in continuous conversation and having that openness with the adult that is in your orbit to be able to walk through like you did with your own children when they made choices, even though they were warned. They didn't have somebody that was judging them. You were talking to them because you were scared of what their choice, the outcome of their choice.
Right. And one of the things that kids have told me over the many, many times, thank you for talking to us and not at us. Mm-hmm. So I try very hard as this old man authority figure. I still try to meet the kids where I think the kids are. Mm-hmm. I try to talk to every audience as a dad, and I think a lot of the kids actually respect that.
Yeah.
But it's going to take us a long time to get out of the problem we're in, and I think that's only going to happen if it's a cultural change. I mean, right now, there's no actual meaningful conversation happening between the United States and Mexico about the drug problem. Mm. We're both talking at each other completely. The cartels are producing as much as they want, and law enforcement's stopping maybe 10% of what's coming in the country. So in the face of law enforcement not being able to stop the tidal wave of drugs flooding into our communities, the only place I see progress is through cultural change created by education and changing the conversation and making schools a place where the kids are educated, where the school leadership assumes drug prevention as a major part of their function, and where we create an attitude in the kids that rejects it. Understanding we're never going to eradicate it, but let's make it socially uncool. And in some places, I think, the schools tell me that that's happening. They sense that after these efforts, not just mine, but after these efforts, they sense a difference in that school climate. The drug use isn't discussed. It's not a thing like it was before.
Yeah, we really need that parent piece too, or that safe adult piece that you were talking about. It's a challenge to get parents to come to parent events. We're doing a lot of educating in the schools now, or we're starting to move the needle in education in certain counties, but we're still missing the realization for the adults of the dangers of today's drug use.
Yeah, and I don't know how we fix that.
Yeah.
And I talk about surveys of our teens, and the CDC did a nationwide survey 2 years ago of American teenager mental wellness. And 44%, this data still is incredible to me, 44% of American teens told the Centers for Disease Control that they feel persistently sad and hopeless. And I still can't get my mind around that. We're the richest country in the history of the world. I use that a lot. We're the richest country in the history of the world. And almost half of our teenagers nationwide told us that they are feeling persistently sad and hopeless. I consider that a pretty serious cry for help. And yet I saw no reaction to that data. I didn't hear any national conversations or state level conversations about, wait a second, how can that be? Richest country in the history of the world. Half of our teens told us they're essentially in crisis, and we just kind of shrugged and we go on. And I think that's because we're all overloaded.
Yeah.
I mean, our teens are struggling mentally. We're struggling mentally. Yeah. And I don't know if you can explain the world to me right now. I'd love to hear it, because our politics is crazy. The economy doesn't make any sense. And the kids are looking at all this sort of insanity going on around them. And yet we still somehow expect the kids to make sense of it, a world that we're struggling to make sense of.
Yeah. Well, Maggie actually has that book of Explaining the World. You can pull it.
How much time do you have?
I'll stay as long as you can. I need help. I need help right now.
So based on what you've experienced, if I were a teacher, or if I were a counselor, if I were a principal, what more could I be doing in the realm of substance use on my campus? And what areas would you say that you've seen school staff miss the mark?
I think the biggest thing we can do is free up teachers to go there. And when a school district will have me come to a staff training, and a superintendent will bring me in to train a staff, and I don't ask for permission, but I tell the teachers, look, by bringing me in, this superintendent is now giving you permission to have these conversations in your classrooms. And then I look and I stare at the superintendent, and they go, yeah. And I know not every teacher wants to do it, but a lot of teachers, I think, do. But they're afraid to. Like, they haven't been told they can have these kind of conversations in their classrooms. And every teacher in every subject can teach drug prevention, because I even say that my talks they're not drug talks, they're motivational talks. Yeah. And I use drug information as the platform, drug information is the mechanism, but my talks are about self-esteem and self-respect and honoring your development, honoring your potential. And to me, I don't care what class you're teaching, and I don't care what age you're teaching. I've had a few chances to teach really little kids, like first and second grade. And I don't give them a presentation anything like I give the older kids. Yeah. But I talk to them about good substances and bad substances and making smart choices. And those kids understand everything.
Yeah.
Right? And my program's called I Choose My Future. And from start to finish, I put it on the students. It's your life. These are your dreams. The dreams you destroy by bringing in drugs and alcohol won't be mine. They're going to be yours and your families. And even very little kids, when I'm talking to them, they're tracking on that. Mm-hmm. So it's that cultural change, and it's going to take all hands on deck, that cliche, all hands on deck. So the school districts that really use me, and your county's one, there are some in San Diego that really use me, they've seen the light. And they're using my presentations as one of the tools, but as a catalyst to create this cultural change, to free up the conversation, to make the kids understand that the school cares, to make the kids understand that the staff at the school actually does understand the challenges they're up against. And I implore the kids that if they're struggling, to find a trusted teacher, find a trusted adult. And that adult will understand, and that adult will try to get them the help.
As someone who has been on a school campus, sometimes initiating that conversation or building the relationship for the youth to feel safe to be able to have a conversation about their experiences, whether it be their experiences with an adult in their life that had been using or something that they are being exposed to with their peers. Are there successful ways that you've seen schools really promote that throughout the entire campus?
I can't answer what happens in a school after I'm gone, right? Now, I do have an interesting job, because many people in education will visit many different schools. Not the way I do, because I go engage with a big chunk of either the whole school or a big chunk of the student population and the staff. And I get to see the culture of the school. I get to see the engagement of the kids, the culture of the kids. I get to see the engagement or lack of engagement in the staff. And there are some schools I visit where I have to ask for the counselors to attend my drug assembly, which I find mind-bending, because I articulate the drug threat. Of the many, many threats to our kids, I think the drug threat is the most imminent, right? And of the many, the most likely to rapidly change their lives or end their lives. And how I would have to ask for a school counselor to attend the assembly that's difficult for me. Now, some of the schools, when the students come talk to me afterwards to share their stories and cry, the counselor is standing there to take that kid. When I stop hugging that kid, and that kid goes with the counselor, grabs and wraps around and says, hey, that Rocky got you talking. Let's continue the conversation. And in fact, every school I visit, there is a population of kids the school knows is having struggles, right? Yeah. Because the kids are manifesting it, or they've been told by social services. There's a history. my experience with kids coming up to me after my presentations is that in every school, there's a population of kids that maybe is big or even bigger that they don't know about. And those kids survive on masking. They just put on the smile mask and they come to school and they don't tell anybody. And it's not because they don't trust the school staff. They may love and adore the school staff. They can't trust the school staff reaction. This kid has, in their world, they've found an equilibrium that works for them. We might think it's atrociously bad for that kid. That's their balance. And if they tell their counselor, they can't trust what's going to happen. They don't want to go to foster care. They don't want mom or dad to go to jail, so they don't tell anybody. And so my presentations get some of those kids to kind of open up, and it tells the schools, we need to get some more resources here.
Yeah. You've also created some additional curriculum to go along with what you do in the schools, some lessons that staff members can work through to help continue that conversation. Can you tell us a little bit about that?
Yeah, absolutely. So just in San Diego County, we have about 750 schools. And so when my superintendent called me in and says, how's it going? I said, great. And I got busy much faster than the San Diego County office thought I would. But working as hard as I could, I hit about 200 schools 2 years ago out of 750. And so the superintendent said, look, you can kill yourself working. You're never going to get to all of our schools. And I don't want to deny any school the information if they ask for it. So we created a project that I thought would be maybe just coming to a school and filming a presentation. But my office decided to create a miniature curriculum out of it. And we broke my single session into 6 different component chapters. They're all 10 to 20 minutes long on purpose so that any teacher in any classroom setting has, the opportunity to use these things. There's a teacher's guide, there's study guides and exercises that come with it. It's both in English and Spanish. So our first goal was to give schools this free resource. There's no registration, they're on our website, but they're being used in interesting ways. And I'm encouraging parents to watch them with their kids because the real conversation, and we've touched on this several times, the real conversation, the meaningful one, has to happen in the home. Yeah. But often parents don't have that conversation because they don't know where to start. Kids are unlikely to come to their parents and say, hey, can we talk about drugs? Because they think the parents are going to react badly or judge them. So I encourage the kids and the parents to sit down together and watch these short videos. The production value is really good. And when this 10-minute video is over, have a conversation. The parent, hey, is that really what you're seeing in the schools? Or the kid, man, that's mom and dad, that's what's going on. I need some support here. And I think that conversation, everybody gets educated, but I think more than anything, it creates a safe space in that home where the kids begin to feel that they can come to the parent when they have a challenge. Yeah,
the parent feels like they can open that door. Because that might be the hardest thing for some of our parents is how do we even have that conversation with our kids?
Yeah, where do you start?
Yeah.
Where do you start? And then, obviously, we don't want to just single sessions. So my assemblies are 1, and these videos are 6 more. And we're looking at ways to create what now? That's something that's still missing. So you get that kid or you get the family that identifies a problem. We want to make it easier or as easy as we can for them to have a next step. Right. All right, now where do you go? Yeah. And that's something for anybody listening, that's... in the past, drug use could be a phase. But today the drugs are so powerful and so dangerous that I tell parents, if you discover or suspect drug use in your child, you treat it like it's a potentially terminal illness, right? Don't be ashamed. That's why I talk very openly about my own family experiences, and that's people like that because I'm willing to be vulnerable. It's because I'm scared about everybody else's families. Yeah. Don't pretend this is something you can fix on your own. If I discovered that one of my children had a lump under their skin, I wouldn't say, I got this. I'm going to figure this out myself. I would run, like get in the car. We're going to the urgent care. And I want parents who fear that there's a drug problem in their kids to have that sort of same, like, I got to get on this right now. And when parents ask me where to go, I always say the school counselor. The easiest place to go, I think, is the school counselor.
Yeah.
And because that person's going to be wired into the community, and maybe that person himself or herself can't offer a lot of help, but they can connect that family with a lot of other resources. And it's a great starting point.
Right. Yeah. It is a great starting point. I love that direction, that directive. At SCOE, one of our core values focuses on being hopeful and helpful. What is your hope for the next generation?
My hope for the next generation really is a hope for us. So one of the questions I'll ask the adults in my presentations is, is the world today dramatically different for our kids than it was 5 years ago? And every parent nods vigorously, absolutely, the world's changed, right? That's the first question. Second question, how much has it changed for our kids? And nobody can answer that because we don't know what we've done to ourselves with social media and the phones and all the stuff that's going on. And I think it's going to take 20 years for people to look back retrospectively to figure out what did we do to our kids. But what I do know is nothing has changed in how we basically run our school systems and how we support and guide our kids. So my hope for the kids is that we begin to give them the guidance that they need and they deserve to navigate, these crazy times that we're all in. If we can't make sense of the world, how can we expect our kids to?
Yeah.
And when I say that to the kids, they look at me with their reaction, Maggie, is like, yep,
Yeah.
that old man gets it.
I got goosebumps because it's the truest statement there is.
Right?
Yeah.
But we adults, we sit back and we scratch our heads and we ask, why are so many kids self-destructing? Why are they making these terrible choices around drugs or sex or sexting or whatever's going on? They're lost.
Yeah.
And we're letting them live in a culture with the phone. And one of the things I teach the kids about I try to teach so much in my single session, right? It's actually, I'm pretty happy with as much as I jam into the single session. But I wish we had many, many sessions with the kids, but I don't. With the phones, the kids don't realize, and maybe parents don't realize, there's a world of people trying to take advantage of your kid through that phone.
Yeah.
Like passively and directly trying to take advantage of your child through that phone. And my dad, when he locked the door at night, locked out the outside world, right? I was the first generation of parent that had to deal with social media and the smartphones. And I discovered I can't lock this out. This is inside my walls of my home.
Yeah.
And so that's when I began to really try to have conversations with my kids. And there's just so many areas where the kids deserve more support. For me, drugs is the thing I know about. It's what I talk about. And I think it is the one threat to the kids that is waiting for them literally. Every party they go to, every best friend's house they go to, there is a potentially deadly threat.
Yeah.
And one example I'll make for teachers or anybody listening to this, I tell the kids, if you went to a party and some teenager walked in with a gun sticking out of their waistband, how would you react to that? And the kids said, well, I'd leave. And I said, well, would you take your friends with you? Would you tell the host there's a problem? Maybe call law enforcement, but you wouldn't ignore it, right? But statistically speaking, a kid showing up with a handful of pills at that party is much more likely to kill one of your friends, statistically speaking, than some kid with a gun.
Yeah.
And yet if some kid shows up with a bunch of pills, are you going to react the same way? And the kids look at me because that's not the normal reaction. So this is the thing I'm trying to teach them, right?
We've become non-reactive.
Non-reactive.
Mm-hmm. Yeah.
So I show a video in my talks of people who died from overdoses, and it's really a powerful tool. It starts out with Ike Turner, who died at 75 years old, and age regresses down to a baby at 11 days old. And man, it's the best tool I ever created. I'm so lucky I did it.
It's a doozy.
It's a doozy. But in middle and elementary schools, it's crazy because when the age of the people that died gets down to be like 12 and 11, the entire group of kids begins to emote.
Yeah.
9, 7, which I love because these little kids are trying to assimilate and process that you're not safe just because not because you're young. But in that video, I show a picture of Len Bias. And Len Bias was one of the most famous basketball players in America, college basketball players in the 80s. And famously, when he signed with the Celtics, his best friends threw a party for him. And to make it extra special, they brought cocaine. And Len used the drug, and his heart stopped. He died 2 or 3 days later. And that affected a generation of people. A bunch of people looked at that and either didn't start using drugs. And people have told me, I show the picture, oh my God, that changed my life. Well, one guy died, and that impacted an entire generation. Our kids today are losing an idol a week or a month. Yeah. They don't react. Some famous person they admire dies. It doesn't impact them the same way that Len Bias impacted all of us because it's become so normalized. Yeah. As a country, we accept 100,000 dead a year. We accept the massive amounts of homeless, the homeless problem. So no one talks to the homeless, I guess, because when I talk to them, I ask them, what's the main reason you're on the streets? They tell me drugs. And then I say, okay, drugs, when did you start? And the ones I talk to tell me, I was in middle school and I was self-medicating for this or that reason. Mm-hmm. I'm 100% of the homeless I talk to tell me they started self-medicating in middle or high school for emotional problems.
Mental health.
Mental health.
Yeah.
And trauma, trying to deal with trauma. And I said, did you get any drug prevention in school? No. And I struggle with that because these poor people suffering so terribly in our streets, they were once upon a time in our schools. And once upon a time when they were dabbling in drug use, we had a chance to reach them. We had a chance to throw them a lifeline, right. And we didn't even try. And they keep using, they don't die, they don't end up on anybody's radar, they just keep using substances until they basically burned all their personal relationships and they end up living, this horrible life in our streets. But I don't read anybody talking about the drug issue and when did our homeless start using. So there's just a lot of challenges to doing this. And again, I'm super grateful to be part of the project the Shasta County, is putting together here.
Yeah, we're grateful to have you throwing a lifeline to the youth here in Shasta County and the educators that'll be at your professional development and the parents that will have the chance to listen to this and hopefully have conversations with their kiddos at home to be able to move the needle the other direction.
Well, thank you. No, and one more thing I need to get out there. According to the government, we are in a fentanyl crisis. The headlines declare we're in a fentanyl crisis, which troubles me because fentanyl is terrible and it is a problem, but we have a huge methamphetamine consuming population. Cocaine is back in a huge way. All sorts of our kids are damaging themselves using the super potent THC and marijuana there is today. And fentanyl is already being replaced. There's a new class of drugs called the nitazines, which are 10 times stronger than fentanyl, that's showing up everywhere in the U.S. now. So as we try very inefficiently to deal with fentanyl, the drug traffickers are already moving to newer and even more dangerous substances. Yeah. And so what I've been saying for 17 years, as I keep waiting for our society to assume some serious responsibility in drug prevention, if we don't get serious now, we're going to be very sad in a year or 2 or 5 years. And I've been right every year for 17 years. And I think a lot of people feel like, we've somehow plateaued and this is as bad as it's going to get. I don't think so. I think unless we react in a big way, everything we're talking about, I come back in 2 years or 5 years, it's going to be, oh my God, look at what happened in the last couple of years.
I don't even know what to say to that.
Yeah, I don't bring a cheerful
message. It's a truth though. It's a reality. Because I think we learned that there's some drug use that we didn't feel was coming towards this direction that is in a neighboring county. And so I think we need to open our eyes and start paying attention and really being present.
It takes one kid.
Yeah.
It takes one kid, one family to bring it in your community. So last year, I went into the juvenile hall here in Shasta County, and I had some really, really interesting sessions. Now, there's no kid in juvenile hall who wants to talk to me when I show up. That's just the given. But when I'm done, by the time I'm done,
they did want to play ping pong though.
I did play ping pong, yeah. But by the time I'm done, it's different.
Yeah.
And so, I like I said, I'm inquisitive. I want to understand why. That's the thing. Too many people talking about drugs today talk about the what. Yeah. What is the drug? What is the drug? What's in my schools? I want to understand the why. Why would our otherwise beautiful, healthy kid full of dreams be so willing to poison himself with this stuff? That's what I'm struggling with. But in the juvenile halls over the years, I've asked the kids, when did you start using?
It's way younger than we think.
Oh, yeah. So it used to be 8, 9, 10. And I remember last year I was in one of the pods at your juvenile hall, and the kids, there were like 4 or 5 kids there, 6, 7, and 8.
Yeah.
All of them.
Yeah.
They started using it 6, 7, and 8. And in most schools, if they let any prevention education happen, it's going to be 11, 12, 13. Right. Years after, some significant percentage of our kids are already using. Yeah. So, and my program is very emotional. It's triggering. And it takes a strong school district, right, to be willing to use that because it does create some emotional reactions, and some families are upset when their kids come home and they're emotional about what they've learned. But my program 10 years ago, a lot of high schools said, well, it's too triggering. We can't have you come and talk to our kids. And my response has always been, if I don't trigger every kid, then I failed, because I need the kids to learn this emotionally. It's easy to learn it intellectually in a classroom, but in a month or 6 months at the party with their best friend or their cousin, and that offer comes out, I need them to remember something that we taught them. But my program that used to be too triggering for high schools, 5 years ago, I got huge access to middle schools. And now in San Diego, I'm getting access to 5th and 6th grades. Yeah. And that's not because the teachers and staff in those schools woke up to all of a sudden that we have to do prevention. If they're seeing the drug behavior now down into 5th and 6th grade. Yeah. And so again, for me, having been in this so long, it's where we are is horrible, but we're on a trend. Yeah. Right? And it's that trend that's really scary to me.
Yeah, and their exposure is probably much younger.
For many of the kids.
Yes.
Yeah, many of the kids is even younger than that. And then if the parents are lost to substance abuse and the kid's not being raised right, and just there's a domino effect of consequences that happen that are difficult to quantify, so we don't. Yeah. We don't really try to measure how many kids are damaged how many kids perform suboptimally in school and life because they were denied anything resembling a normal childhood. You know, and we count this overdose death, and I think we overemphasize the overdose death. It's very tragic. So when I'm teaching, I don't differentiate in my public discourse between a fatal or a non-fatal overdose. Because whether God or Narcan saves that poor human being, it's the behavior that I'm fighting.
Right.
I'm fighting that crazy willingness to just gamble with everything. And I'm confused why our society still allows people to make that seem normal and even desirable for our kids.
Yeah.
Yeah, I think a lot of people don't feel like it'll happen to them.
Mm-hmm.
Oh, I've met a lot of parents, these grieving parents. And, I think when as a parent, and it's funny, I used to think with 3 daughters, the scariest thing, when my girls were little, I'd say, man, it's going to be terrible when they start dating, right? And my friend who had daughters said, no, dude, when you hand them the car keys, and true enough, the first time I gave my daughter the car keys and watched her drive away, I'm like, oh, this is scary, right? Please come home, baby. But it's just so scary. But as a parent, you can sort of get your mind around the thought that you might lose your child in an accident or to a disease, right? As horrible as that is.
Yeah.
But when I meet so many beautiful people who are grieving a child lost to substance abuse, there's something different. There's a inward focus. Like, how did I fail to teach that kid? How did I fail? The teachers, one of my friends in San Diego has lost 19 former students to overdose. And he does it. He blames himself as a teacher. Like, what did I fail to teach those kids? What did I miss? And of course, it's not the parents' fault and it's not the teacher's fault.
Right.
But it's just this pain that's inexplicable, that this loss happened. And one thought on where society is. So 15 years ago, when OxyContin hit San Diego, I worked to support a lot of families who lost their kids. And I was in meetings with them and all these conversations about things we would change in society. Well, time goes on. 3 years ago, a father who lost his daughter to fentanyl asked me to join a Zoom call with a group of parents, newly grieving parents with fentanyl. And I joined the meeting, and I was overcome with melancholy, and I had to leave the meeting because it was like I was in a time machine. So all these families in 2021 are talking about all these changes we're going to create in society. We're going to get it in the schools. We're going to warn our kids. We're going to change the culture. Exactly the same things that these families had discussed in 2008, none of which has happened. Wow. And I just had to go, you know what? Okay. So it was depressing but motivating because I know that of every 100 kids I talk to, at least one, I believe that of every 100 kids I talk to, at least one's going to come away a little more empowered to say no thanks, when somebody tries to offer this to them.
Yeah. I think that's all we can hope for with that conversation is that it'll change somebody. It'll make somebody choose to not choose to use and choose their future.
And the challenge is we'll never know, right?
Yeah.
And so people in a modern society, they want us to quantify everything. Show me the metrics. Show me the numbers. Well, how do you measure, right? People claim they can do it. I don't think it's even possible. There's so many variables in this, in society and the different opportunities for people to use different substances. So I look at what we are doing now with this drug prevention. That's just a basic thing. But nobody questions the value of teaching your kid to look both ways before they cross the street or to not take candy from a stranger. These basic things we teach our kids. And so I view what we're doing this week with the kids in Shasta along those lines. This is just basic teaching. Every kid deserves to have it. Fully recognizing that some giant percentage of the kids may still make the same bad choices. But
we appreciate you being here and taking the time to sit with us today and talk about all of the amazing work that you're doing and trying to educate youth, educators, and parents on what we need to be doing so we can stop having so many deaths with drug use.
Well, I teach all over. And I'm not seeing these kind of coordinated efforts happening many other places. So I'm really proud to be part of the project that you guys are trying to build and design and to offer some supports as you move forward. Because what you're trying to do here in Shasta County, I'm not seeing it a lot of other places. So keep up the good work.
Thank you.
Thank you.